Hello everyone, I am Snigdha Bharadwaj, Assistant Professor, ITS College of Pharmacy. I welcome you all in my session. So, in this session we are going to discuss about various pharmacokinetic parameters. So, let us get started. Basically, in our earlier sessions we have uh, discussed about different basic pharmacokinetics definitions and introductions, and the basic compartment models and physiological models, and also non-linear kinetics. And all in compartment modeling we have discussed modeling for that zero order kinetics, first order kinetics, and followed by that discussion with specifically IV bolus administration, IV infusion, and extravascular administration. But after that, in all these processes we have discussed at somewhere that the importance of AUC, Cmax, Tmax, volume of distribution. But now in these sessions, coming sessions, we only focuses on the pharmacokinetic parameters, the why it is important and how it is calculated, right. So, the importance of pharmacokinetics parameters useful in assessing the bioavailability of a drug from its formulation. So, basically why we are assessing these pharmacokinetic parameters using compartment modelings of first order and zero order kinetics, because using these pharmacokinetic parameters and their assessment, we can identify the drug bioavailability, that means bioavailable drug, the rate and extent of the drug reaching to systemic circulation, because the drug reaching to systemic circulation is the only way to exert its biological activity in the patients. Yes. So, it is very important to identify bioavailability of a drug product, and also it is helping in setting the dosage regimen and how, what amount is suitable for the to show the desired effect, and whether it is safe or toxic level reaching or not. So, these all are interlinked parameters which can be assessed using these blood and plasma profile time concentration curves. So, one by one we will be discussing all. So, three important parameters useful in assessing the bioavailability of a drug from its formulation are peak plasma concentration Cmax, the point at which maximum concentration of drug in plasma, basically units, it is calculated in microgram per ml, as we collect very minute samples, and we can expect that the dose present in plasma is in microgram. So, we take concentration in units as microgram per ml. Okay. So, peak concentration related to the intensity of pharmacological response, it should be above MEC but less than MSC. So, MEC here is minimum effective concentration and MSC is maximum safe concentration. So, basically it is related to the intensity of pharmacological response, it should be above MEC but less than MSC. The peak plasma level depends on administered dose and rate of absorption and elimination. So, peak level depends on administered dose, what amount you are administering, right, to any we can say any route of administration, and what is its rate of absorption and how much in how much time it is getting absorbed and eliminated, right. So, time of peak concentration Tmax, the time for the drug to reach peak concentration in plasma after extravascular administration, or we can say basically we get this curve. So, this point is Cmax and this is your Tmax time, as this axis shows time profile and this shows plasma profile of drug. So, this point is your Cmax and this is Tmax. So, basically time for the drug to reach peak concentration in plasma. So, units is hours, useful, or minutes we can say, useful in estimating onset of action and rate of absorption. So, generally it is useful in estimating or analyzing onset of action and how much time the drug is reaching to its peak concentration. So, Tmax is very important in that terms, and rate of absorption important in assessing the efficacy of single dose drugs used to treat acute condition. Important in assessing the efficacy of single dose drug used to treat acute conditions like pain, insomnia. So, obviously, this time peak concentration at time of peak concentration will give you, because it is also relevant with your MSc and MEC, understand. So, this is all relevant. So, this is basically giving you an idea of the drug efficacy of a single dose. If you are giving as a single dose, then it should be ranging this limit, therapeutics index or therapeutic regimen we can say. So, this is how we calculate all these parameters. Area under the curve. So, in this profile, area under the curve, this area will be called as AUC, area under the curve, understand. So, area under the curve, it represents the total integrated area under the plasma level time profile and expresses the total amount of drug that comes into systemic circulation after its administration. So, as I have told you that this will be called as AUC, area under the curve. So, it is integrated area under the plasma level time profile curve and expressing the total amount of drug that comes into systemic circulation at particular time. We have administered a dose and it is showing this profile. That means, total this much of amount of drug is going into systemic circulation, because otherwise once it is reaching to systemic circulation, it is absorbing and then eliminating from the system. That means, that particular area is showing is directly proportional to the amount of drug present in your blood. So, units will be microgram per ml, hours into hours, represents extent of absorption, how much drug. So, you have heard that some drugs have less dosage, right, and some has more. For example, like some have 10 mg dose and some have 500 mg dose. So, based on their potency and their binding affinity and their potent nature, that in small quantity they will show the big results and big medicinal effect in the body. So, basically extent of absorption and bioavailability will be high. So, based on these parameters the dose will be decided. So, area under the curve represent the extent of absorption, and it's helpful in evaluating bioavailability of drug from its dosage form. Important from drug administered repetitively from the treatment of chronic conditions like asthma and epilepsy. So, these are important to identify drug efficacy and safety in terms like the patient is suffering from severe illness and the frequency of dose is very high. So, we can identify its efficacy and safety in that case. So, fundamental parameters one compartment here. So, in one compartment we generally identify apparent volume of distribution, elimination rate constant, elimination half life and clearance. So, these are following parameters which are important to be assessed. So, apparent volume of distribution VD. So, here we will discuss it in detail. In general, drug equilibrates rapidly in the body when plasma or any other biologic compartment is sampled. So, drug equilibrates rapidly in the body, that means distribute easily uniformly in the body when we considered it as one compartment model. So, when plasma or any other biologic compartment is sampled and analyzed for drug content, the results are usually reported in units of concentration instead of amount. So, concentration we generally analyze instead of amount, although amount is equivalent to that particular concentration. Each individual tissue in the body may contain a different concentration of drug due to differences in drug affinity for that tissue. Therefore, the amount of drug in given location can be related to its concentration by a proportionately constant that reflects the volume of fluid the drug is dissolved in. Yes, so each tissue and individual based on you have seen in my earlier sessions that we have discovered this type of highly perfusion, less perfusion, very low perfusion areas or organs and fat tissues. So, these are what the based on these type of characteristics the organ or the body parts has its own characteristics to bind with the drug, right. So, each individual tissue in the body may contain different concentration because of this different characteristics, because of they have low perfusion rates, that means blood flow is not that good. So, they may have lesser binding as compared to the organs with higher blood flow or vascularity. So, therefore, the amount of drug in a given location can be related to its concentration by a proportionality constant that reflects the volume of fluid the drug is dissolved in. So, the amount of drug in a given location in any of the organ, so amount of drug can be related to its concentration present in present in that particular organ, which reflects its volume of fluid. For example, if we talk about the body as single compartment, so overall fluid, what concentration of drug is containing in that particular fluid, we can analyze the volume of distribution using different compartments volume of drug contained, so dissolved in. So, as you see, the volume of distribution represent a volume that must be considered in estimating the amount of drug in the body fluids from the concentration of drug found in the sampling compartment. So, you must have seen when performing experimentation, we are taking small sample from the main component, that is we are consider it as a body and we are taking different samples at different time intervals and analyzing the value. So, from that particular thing we can identify the required parameters. So, you see this is the main compartment. Here the concentration volume is 100 liter and the concentration is 1 mg per liter. So, it is a central compartment basically and the concentration is 1 liter, where in this small organ, if we see that 100 mg drug is present. So, in this 100 liter 1 mg drug is present, whereas in 10 liter 10 mg. So, we generally take that depending on the type of body compartment and fluid present. So, the drug is distributed as per its volume. So, if we talk about 100 mg drug and if it taking it is going to that particular component compartment which is having higher volume. So, the concentration will be very less, like 1 mg per liter, as compared to that organ which is having low volume, the concentration of drug will be high, 10 mg per liter. So, concentration basically is equivalent to amount we are calculating. The real volume of distribution has physiological meaning and it is related to body waters. So, body waters, as I have told you, fluids, body fluids. So, total body water basically it is 42 liter in normal individual. So, it is divided as plasma, interstitial fluid and intracellular fluids. So, basically if drug is entering to the body, it is spreading or distributing among all these body fluids, and then if we assess these individual body fluid, the drug concentration in these individual body fluids, we can be able to understand how much drug is distributing in how much in particular body fluids. That means, we can analyze it to that distribution pattern of the drug. Okay. So, basically plasma volume 4 liter, interstitial fluid volume 10 liters and intracellular 28 liter. It is an approximate value, it is not definite for a specific reason, because all individuals have their physiological variations. So, after that in apparent volume of distribution, drug which bind selectively to plasma proteins, example warfarin, have apparent volume of distribution smaller than their real volume of distribution. That means, we are identifying that at particular time what will be the distribution. So, that is known as apparent volume of distribution, it is not real. At that particular time, if the drug shows immediate binding to plasma proteins, for example warfarin, that will give you the apparent volume of distribution smaller than their real volume of distributions. So, drug which bind selectively to extravascular tissues, example chloroquines, have apparent volume of distribution larger than the real volume of distributions, basically the actual one, right. The VD of such drug is always greater than 42 liter total body water. Basically, what we are saying apparent, because these are real values they have mentioned, but in some case which has plasma protein binding, it is good that in that cases the volume of apparent volume is quite smaller than the real volume, whereas drugs selectively bind to extravascular tissues. Extravascular tissues, basically not to plasma proteins, not to plasma proteins means body tissues. So, in that case the distribution, basically apparent volume of distribution is larger than the real volume of distribution. So, it is always greater than 42 liter total body water. So, apparent volume of distribution, lipid solubility of drug, these are factor affecting the distribution of drug is affecting by these particular parameters like lipid solubility. If the drug is more soluble, lipid soluble, then it is easy to be absorbed and easy to be bind to body receptors. Degree of plasma protein binding, how much binding affinity is there of the drug with the body receptors. Fat, lean body mass or heavy mass is there. So, it is also affecting drug absorption in the body. Disease like congestive heart failures and uremia, cirrhosis, all these disease conditions severely affect the drug distribution within the body compartments, due to as it alters the functions of vital organs. So, it may affect the distribution pattern. So, in normal patients the drug is showing very good binding, but in diseased patients it is not showing due to their physiological variations. In general, drug equilibrates rapidly in the body when plasma or any other biologic compartment is sampled and analyzed for drug content. The results are usually reported in units of concentration instead of amount. Generally, we calculate concentration microgram per ml, milligram per ml instead of that particular amount. It denotes basically the amount value, but we generally calculate the concentration in particular compartment. Each individual tissue in the body may contain a different concentration of drug due to differences in drug affinity. Yes, as I have told you that based on their highly perfused, low perfusion and medium perfusion fat tissues, they have the body tissues had different binding affinity to the drug, and they show different binding behavior towards drug. So, therefore, the amount of drug in a given location can be related to its concentration by proportionality constant that reflects the volume of fluid the drug is dissolved in. So, apparent volume of distribution, how it can be mathematically expressed. The volume of distribution represents a volume that must be considered in estimating the amount of drug in the body from the concentration of drug found in the sample compartment. Yes, we are considering that first it is entering to a central compartment, yes, and then it is spreading to the attached or adjacent compartments like body tissue, body fluids and other vital organs. So, main compartment or central compartment will be considered as your systemic circulation or blood plasma compartment. So, it must be considered that in estimating the amount of drug in the body from concentration of drug found in the sampling compartment. So, it is going out or it is connected with other peripheral compartments as well. So, we have to calculate all these parameters, all these central compartments to get the exact concentration present in the body. In order to determine the apparent volume of distribution of a drug, it is necessary to have plasma serum concentration versus time data. So, V d is equal to dose divided by initial concentration. So, it can be expressed as x naught by C naught. So, apparent volume of distribution estimation can be identified using plot log C versus time, plot the best fit line, extrapolate to y axis intercept to estimate initial concentration, estimate V d. So, all these plots we have discussed earlier in our previous sessions. So, this is the final formula to calculate volume of distribution. So, these are different types of graphs we have here, logs value and time, log concentration. These are different representations basically. The log graphs is there, the best fit line, you add trend line to the points of deviation or sample collections to see the is there any regression and deviation from the main point, and now extrapolate on y axis on the intercept to estimate CO. Now, you can extrapolate, yes, from that point, that CO at time 0, the what will be the concentration, right. If you are giving 100 mg, so initially it will be like 100 mg. So, you can easily extrapolate that concentration, and using this estimated V d log graph, you use this dose divided by initial concentration. So, initial concentration is this point, and you can easily calculate the volume of distribution. The extent of distribution and V d in a 70 kilogram normal man. So, generally V d per liter, basically in liters 5, if 5 the percent body weight is 7, and extent of distribution only in plasma. Generally, depending on the body fluids, we are considering that if it is like in this range, so it will be distributed only in plasma. If volume of distribution in liters we talk about is ranging from 5 to 20, the percent body weight we are considering 7 to 28% of the human. In extracellular fluid we can say that it is present. 20 to 40, 28 to 56 of body percentage we are covering, and in total body fluids we are considering volume of distribution. More than 40 and we are covering more than 56% of body weight, and in deep tissues, bound peripheral tissues, all we are taking into considerations. Elimination rate constant. Elimination rate constant after volume of distribution, this is another an important parameter to assess pharmacokinetic profile of a drug. Elimination rate constant represent the fraction of drug removed per unit of time. K has unit of reciprocal of time, example minute to the power minus 1, hour minus power 1. So, with first order elimination, the rate of elimination is directly proportional to the serum drug concentration, the drug concentration present in blood plasma. So, elimination rate constant estimations can be done using plot log C versus time, plot the best fit line, calculate the slope using 2 points on best fit line. So, estimate elimination constant can be done using this K is equal to minus slope into 2.303. So, this is how you can estimate the points. This is the plane points time log profile, and this is best fit line, you add trend line, and then you can identify C1 point concentration at T1 and C2 different using this value, the slope using 2 points on the best fit line. So, any 2 points you can consider to identify the concentration at 2 points at 2 different times, and estimate K using this. After identifying these 2 points, you can use this equation to calculate elimination rate constant minus slope point 2.303. Elimination half life is sometimes called biological half life. The elimination half life is defined as the time, hour, minute, day, etc., at which the mass or amount of unchanged drug becomes half of its initial value, that is also known as T half. So, two methods can be used to calculate the value of k t is, it is interlinked, every parameters is interlinked. If you identify one, you can calculate another one. So, T half is equal to 0.693 divided by k, directly from concentration versus plot. So, best fit line, from best fit line graph you can take out concentration and look at the look for the time that is needed to get 50% of C1. So, at any point you can identify C1 and you are taking time at which it is getting reduced to its initial value, 50% to its initial value. So, these are references. I hope you understand basic pharmacokinetic parameters, although we will be continuing this same topic in our upcoming sessions. Till then, take care and stay safe. Thank you.